All right, everybody, it is noon, and I am so excited you all are joining us here on this fine Thursday. I am Andrea Strohmeyer, a science educator at the Health Museum. And today I am pleased to welcome you all to Championing Minority Mental Health, which is the third installment of the Parents Let's Talk About Mental Health series with the Menninger Clinic and the Health Museum. Today we have Dr. John Stevens, who is the Medical Director for Outpatient Services and Admissions, as well as the Vice President of Growth and Innovation at the Menninger Clinic. He is a board certified physician in adult as well as child and adolescent psychiatry. Dr. Stevens came to the Menninger Clinic in 2015 to relaunch outpatient services. At the clinic, he and his team have built innovative programming to serve patients in the community as well as even in their own homes. Dr. Stevens, I'm going to hand it over to you.
Well, I'm so happy to introduce my colleague, Mr. Michael Riley. This is a really important topic. It's very timely. I'm really interested in hearing about it. It's been top of mind in terms of the mental health tsunami we've had after COVID, which has disproportionately affected some communities more than others. And Mr. Riley is going to talk about some of these communities today. So it's very topical. It's a very important topic. And it's by, as you'll see, an excellent speaker and advocate for these issues. Mr. Riley's been with the Menninger Clinic in various roles now for how many years, Michael?
This is my ninth year.
Ninth year. And I've had the pleasure to work with him for 6 of those years. He most recently has been one of the program managers of the Pathfinder Community Reintegration Programs. That's a mouthful, but it's basically helping those young folks in our community in late teens, early 20s, launch into adulthood if they've had struggles in college, employment, or in their home. And very recently was promoted to be the program director of our Menninger 360 program, which you just heard is basically a hospital without walls, providing care in the comfort of people's homes to keep them out of the hospital. So with that, I'm very pleased and interested to listen to Michael's presentation today. Michael.
Great. So thank you for having me. I'm pretty excited to talk about this topic. I think it's very timely as we are in Minority Mental Health Month. And so what I want to think about with the topic, and I added to the title of Champion Minority Mental Health, is how do we strengthen in our homes and our communities our resilience to mental illness and improve our mental wellness. So strengthen in our homes and communities is where we're focusing today. What I want to start with is by saying that minority mental health is a very broad topic. So I want to give the disclaimer that no one can be an expert in all minority mental health. And so when we think about Black, Indigenous, and people of color in those communities, it would be very hard in a 20-minute session to cover every single barrier or intricate detail of what these communities are facing. So I'm going to try and cover that in a pretty broad scope. But if we think about the US population, about over 41% of the US population identify as people of color, 13% are from outside the US, and then 4.5% identify as LGBTQ+. And I wanted to focus on that last piece because I'm not going to emphasize this as much today, but when we're thinking about people of color, also thinking about people of color who identify as LGBTQ, that's going to add to any of the stressors or barriers they see that we go over today. So why do we talk about minority mental health, and why is there Minority Mental Health Month? So Minority Mental Health Month started in June of 2008. That's the first official one, and it was Dean B.B. Moore Campbell National Minority Mental Health Month. B.B. Moore Campbell was an author, advocate, teacher who really wanted to focus on mental health and mental health of minority populations. I'm not going to focus on B.B. so much today, but more on her work. And so the reason we want to emphasize minority mental health is because we know that over 830,000 Native American and Indigenous Americans, 6.8 million Black Americans, 8.9 million Latinx or Hispanic Americans, and 2.2 million Asian Americans live with mental illness every day. That said, a very small number of them seek treatment compared to their white counterparts. And so I'm going to start the presentation talking about some of the barriers because I think as we think about being a parent or a caregiver and how we talk to our children, we really need to understand the history of why mental wellness and mental illness is such a hard topic for people of color. So some of the barriers I'll go over in a few minutes are some of the limitations from the medical model and a history of distrust in the healthcare system, as well as some of the stigmas. But where we'll really talk today is really around current stressors and how that's impacting both us and our children, and how do we talk to them about it. So going over that first one, there's this idea of the Western medical model, and that really emphasizes treatment based off of empirically based evidence. So that's data and outcomes and research and analysis. And it's all great. And it sets the foundation for how we do our jobs as clinicians and healthcare providers. That said, when we're doing things based off of evidence, you need a population that's representative of who it's going to serve. Often the research for these treatments and methods don't include people of color at the same ratio that we would need to see if it's going to be applicable. So while Western medicine is quite helpful for people of color, it may not always be the whole picture. We may want to think about more holistic medicine. Similarly, there is a history of distrust with the healthcare field that as a parent, when we're teaching our children about how to seek providers, we'll want to think about. On this slide, I'm going to talk a little bit more about the community and the Black experience because I have more examples of that, but there's evidence of this through many different communities. And so the first is a long historical cultural distrust. And so some of that comes from situations across time where people of color weren't treated well. So one of the examples I have here is the father of gynecology, James Marion Sims, actually learned a lot of the procedures by experimenting on Black slaves without anesthesia. Similarly, the Tuskegee experiments refer to the experiments on Black Americans who thought they were getting a treatment for syphilis when they were actually being injected with syphilis. These things did eventually lead to the advent of having research boards about human experimentation and things like that. But it doesn't change the fact that while this stuff isn't happening right now, this led to a systematic distrust of the healthcare field. Similarly, and I know this slide has a lot, so breaking down that second half of the slide, in short, people of color both experience more distress from psychological disorders, but also get overdiagnosed and misdiagnosed at the same time. So what we know is that while Black, Indigenous, and people of color are going to have comparable rates of mental illness to their white counterparts, the distress they experience from that is going to be higher often because of different things they face in the world. Similarly, there are going to be times where they are still diagnosed because there is a real illness there, but what they're diagnosed with is inaccurate. So one of the things we know is that Black men in particular are overdiagnosed with schizophrenia at 4 times the rate of their white counterparts. All of this is to say, there is an intergenerational and a cultural trauma that gets passed down to our children when we start to think about healthcare. For the sake of today's discussion, we're not going to focus as much on this part because this is the stuff that as providers, we need to figure out what we're going to do to rebuild that trust. But for parents, we need to be thinking about what are our children hearing from us and from their peers and from other people in their communities that may make it harder for them to seek mental health care. Some of the stuff we can start to address, though, are stigmas in our communities. So one of the most common ones I hear is that depression is a white disease, or more specifically, mental illness is a privilege. So much of the story for people of color is about overcoming and their identity having something to do with resilience and being compassed or worked through. But that often doesn't leave space for our children to, and for us to think about, how do I deal with what I'm feeling? And I'm going to touch on the resilience piece a little bit later in the presentation. Some other common ones are struggling is weakness, and therefore mental illness is weakness. And if I have mental illness, that may be used against me in my job, in my relationships. I may get preyed upon by people. Outside of it being weakness, sometimes it's outside our communities, the idea of stereotypes that then make it harder to ask for help, right? So the model minority stereotype. So a lot of Asian cultures will experience this where they're told you're smart, you're successful, you're supposed to be doing these things. It may be harder to ask for help or to look for help or even to say, maybe I am struggling with depression or anxiety. All of these things are things that we can start talking about as communities and start teaching our children that these things aren't true or a different way to think about these things so they can ask for help. So I want to pause there and check in with John because I can't see the question. Is there anything we need to address right now or should I keep going?
I don't see any questions yet, Michael. I think it's great. Please keep on going, and perhaps please send the questions in as this stimulates you. It's already raised some questions in my own mind, and maybe we'll at the end kind of go through it as a group. Is that all right, Michael?
Perfect. Just wanted to make sure.
Thanks.
All right. So we've gone over some of the historical things that have been barriers for communities of color to access treatment. What I want to focus on in the presentation a little bit more today were some of the things that are unique to both this time period and this generation. So I broke down recent stressors into kind of three categories. I'm sure there's many more, but I've covered some of the things that we've experienced in the last year. And a big component of that is we have so much more access to information, misinformation through technology than we did before, even when I was growing up. And this is something we have to be thoughtful about for both how we're taking information, but what our kids are seeing. Some of the younger kids are still seeing some of these things, even if we have parental controls on their devices and things like that, because there's always a friend who doesn't have that, or maybe a sibling or a cousin who shows them something. And so we really have to be thoughtful about what they're seeing. So some of what we think about just in the last year, current events, right? So we've been in a pandemic for a little over a year now, and that has increased isolation for all of us, but particularly for children, and that's really disruptive to their routines. And we know that children need their routines, but also the social engagement as they develop through life. Additionally, for some of the pre-adolescent and adolescent children, they're learning about how to take care of their health. Well, with all the information about vaccines and not taking vaccines and what's helpful and what's not, it can be very confusing at this time for them to understand how to navigate the world. I have on there changing in laws as part of the current events. And so I was thinking more specifically in this, your pre-adolescents and adolescents who, one perfect example is the ones who are beginning to identify as LGBTQ+. So seeing things like battles in the court systems around gay rights or around bathroom usage, regardless of where you stand, they're watching this and seeing how the world is going to respond to them as they figure out more about themselves. So these are things that are going to impact their mental wellness. The second big one that's come up in the last couple of years is this race-based vicarious traumatic stressors. That is a bunch of really big words to say when we see something traumatic that we didn't live through, but we still kind of lived through it by witnessing it. The biggest one from the last year was George Floyd, and not just George Floyd's murder, but also the trial that played out afterwards. For children, this is a major event that they don't totally understand. So when I was growing up, I remember little bits and pieces about the O.J. Simpson car chase and a little bit about the trial. I can only imagine what my nieces and nephews are going to tell me in 20 years was their experience of this. So we need to be thinking about how we're going to talk to our kids about that. The last set, oh, and the other thing with this too is with the undocumented immigrants. Again, this is one of those situations that regardless of what you stand, where you stand, many children of color are seeing children in detention centers, children being denied access who look like them. So what are they learning about the world? The last set of events that kind of was on my mind when I was thinking about this presentation are less around just the racially specific, but more around things that divide us as a nation, so polarizing events. And so I was thinking about the election and the siege on the Capitol, and why that becomes important is children are at the age where they're learning who's like me and who is not, who can I trust, who do I be cautious around, and what happened during this time is we became very divided and very polarized as a nation. And so now our children are watching how we respond to each other and using that as a foundation of how they build their thoughts about themselves. So, what do we do? One of the things I think about, and I love this quote, which is the way we talk to our children becomes their inner voice. As a family therapist, one of the things we'll say to the family is when we treat your child, it's not just us treating your child, but all of you all are in the room with them. And whether you're actually there or not, because they're taking everything they learned from you. One of my colleagues who did the first series said that a parent's role is to protect, provide, and prepare. And I disagree with that so much. We are building the scaffolding for who our children are going to be when they grow up. So whether it's because they're going to try and do the exact opposite of us, or because they're going to really try and follow in our footsteps, we're setting the foundation of who they're going to be. And that starts with how we talk. So to the nuts and bolts, how do we talk about this stuff? I think the first thing as parents, what you can do is model. So as I said, children are always watching. It always stood out to me when I would go back home and visit my nieces and nephews. They would remember some random thing I said from the time before that seemed innocuous to me, but they held on to dearly. With our own children, that's happening every single day. When we hide from them how we're responding to these things, we're taking away their opportunity to start to learn from us. That's not to say we want to rely on our children to be our supports, but we want to start to show them how we manage our responses to these things. The second big thing that is can often be hard, whether it's because we want to protect them or we don't feel like we have time, it's so important to acknowledge what's going on. With some of these really big events, we're just not going to be able to hide these things from them. As I was saying before, technology is rampant. Even if you don't let your children have cell phones or access to iPads, one of their friends at school has it, and it's probably showing them. So being able, when it's the big things, to sit down and say, hey, what do you know about this? Let me explain to you how we understand it, and let me be open if you have questions. The third part of this is being curious and validating. So asking your child questions about what are you feeling? What's going on? So this big thing we just talked about, what's coming up for you? The younger kids, you might have to give them some options of feelings and help them understand it, but you really want to make space for that. And it can feel really hard and we may want to protect them from it or explain it away. But the first thing we need to do is just validate that what they're feeling is real and normal and appropriate and help them understand how they're going to process that. The last piece for the current events piece is how do we teach them? So how do we help them understand what they might be feeling is okay? How do we help them understand what coping skills they can use for it? But also, how do we help them understand the real risks that they'll face with some of their identities in the world? The goal here isn't to scare them or to make them jaded, but to say the world will see you different in ways. And so how do we acknowledge that and talk about that? So moving away from the current event piece and just thinking more about mental illness, mental wellness with our children, one of the first things we want to think about with children is just what are the developmental milestones they're supposed to be hitting and are they hitting them? Where this gets unique with minority cultures or the BIPOC cultures is that that has to do with what your family system culture and your bigger racial culture will tell you is normal, right? So in the American model, it's a lot of what we call individuation and separation. So as they get older, we want them to kind of move away from us a bit. But that's not the same for every family system. Many families say, hey, the goal is to take on more responsibility in the family appropriately and to help support the siblings or the grandparents or the parents as we get older. The idea here is whatever those milestones are in your system, are they hitting them? If they're not hitting them, it's not necessarily bad, but let's be curious. More specific milestones, or not milestones, warning signs for in children, though, are listed here. And so the first thing I'd say is let's look at what the stakeholders have to say, right? So what are the teachers telling you? What are the coaches telling you? Whether nannies or babysitters telling you? Another big thing to look for is any major changes that are happening in their life, right? So losses, deaths, divorce. Again, one of the things I grew up with is this idea of be strong because you're still here. And my family is very loving and supporting. They always supported me. But we talked about as I got older, hey, this kind of sent a message for me that it wasn't okay for me to not be okay. We then went and started having conversations around that, which changed how I understood grief. So understanding those little messages we're sending around these major events is really important. Finally, just some practical things are, is your child more withdrawn? Are they acting out? It's really tempting when a child is moody or acting out or talks back to say, don't talk to me that way. I can tell you some things my mom has told me before and we laugh about now. But it's good to be curious afterwards, right? To set an appropriate boundary, but then come back and say, hey, what was going on there? Why were you acting this way? This is a way to kind of generate more conversation and do that thing we were talking about a few slides ago, where we're really helping the child feel heard and like their emotions are appropriate. One other one that I want to emphasize a little bit is the overly responsible. And so what we'll see, especially with some children in communities of color, is they will become what we call a parentified child. So they'll be the one that's always taking care of their sibling, or they may even start trying to take care of you. That can sometimes be a really good sign that something's going on with them. So one of the things I think about with a lot of the families I work with is the cost of resilience. So resilience is a great thing. This is not to put it down, but sometimes we misuse resilience. So to think about resilience, I want to go back to trauma for a second. When we think about trauma, trauma is a normal response to an abnormal situation. Being through the pandemic, witnessing the trial of George Floyd, all of those things this last year, it makes sense that people feel more anxious or feel more depressed. It makes sense that they're questioning their self-concept. But what often happens for communities of color is what we tell ourselves is this is how it's always been, this is how it will always be. And I have to just keep pushing forward. Resilience becomes a way to not process or leave things unprocessed. What we want to start to do is undo that. So when we see that in our children, when they become that parentified child where they're caretaking us or caretaking other people, we want to slow that down and check that out with them. It could legitimately be there being a good big brother or big sister, but it could also be that something's going on for them. So how do we do this? I'm someone who's a big fan of saying you saw an ounce of prevention is more than a pound of cure. I did that wrong, but that's okay. The idea here is what are the basic things that children need that we can help as parents that go a long way for mental wellness? In working with the clients I work with here, we ask about 4 things every week when we meet with them. And it's the very first thing. How are they sleeping? Are they eating? Are they exercising? And are they keeping up with their hygiene? That stuff is so important. And the more stress we get as parents, the more important it is for us to make sure they're still getting those basic things. The second thing on this slide is what we call a sense of mastery. This is basically, does your child feel like they're good at things? Do they feel like they can do a task that maybe is hard, but at the end of it, they feel proud of it? Whether it's reading or riding a bike or writing, we want to make sure we know what that is for our children. And then finally, children need play. So as parents, how do we make sure they're getting play? Also, how do we get some too? The more we do that, the more they see it and the more they make space for it as well. So those are all things as parents of communities of color that often because of the limitations on our time or resources can be the first things to go by the wayside, that if we can really watch that, we can put a big dent in the amount of mental illness that shows up in the community. So if we're doing that, and then we think about maybe this person does need help, the question becomes, how do I find it? So one of the things that's important when seeking a therapist is looking for someone who we see as what's called culturally competent. So that basically means, can they answer the questions below effectively and can they practice effectively? Are they comfortable discussing race? Are they, what is their style in talking about it? Are they able to get feedback from you? How are they making decisions? Are they making decisions with you? What we know about a lot of communities of color is that the reason they don't follow up with doctors or clinicians is they'll leave and say, I didn't feel like they listened to me, or I felt like they just talked at me for 20 minutes and then they walked away. So asking them, how do you make decisions about my care? What is my role in that? Do you speak do they speak another language? So do they speak your language? If I speak two languages and I feel fluent in it, that's great. But if I don't feel fluent in it, there's a lot that can get lost. Same for my children in between what I'm translating and what I actually mean. So all of these things are questions to be thinking about. Similarly, what am I looking for in a therapist with my child? Is race important in this conversation? Maybe it's not. And so then how do I talk about that? At the end of the day, the last piece is how do I find people who I trust by asking the people I trust? Do I find reviews? Do I use resources that I know have a temperature on my community? So the last part, getting back to the strength in our communities, is alternative ways to think about mental wellness. And so when we started, I talked about the Western medical model, which is really emphasizing, so here's this illness and how do we treat it? What we're moving towards is more holistic models of saying, so if I look at this person as a whole person and a whole that's a part of a bigger community, what do they need? We just talked about the self-directed care. The second piece is how the culture supports wellness, right? So culturally based practices that really promote improved mental health. We know spirituality, when appropriate, can be an amazing tool for people's mental health. So how are they connected to their church or synagogue or temple? If that's important to your child, how do you talk to them about that? How do you nurture it? If it's not important to them, how do you help them think about how are you thinking about spirituality and keep them connected to a community in some way? Similarly, multi-generational households. So I was talking about my family earlier, and I'll use them as an example again. Growing up, we had probably 3 different birthdays a month every year, which meant I saw all my cousins, aunts, uncles. That, for me, taught me a lot about how I navigate relationships now, how I let people get close to me. It did a lot for helping me feel connected and whole. So thinking about those things in each individual culture that are gonna generate mental illness, not because we're talking about it, but because it's giving the person a sense of wholeness. The last thing is thinking about community care, and this is often seen as peer supports, right? So some of the examples of this is available that we often don't utilize, but are great resources that are free are things like Big Brothers, Big Sisters is one of the oldest ones. Here in the Houston community, we have the Montrose Center, which is a free resource for members of the LGBTQ community to go to and feel connected and whole. The one I wanted to talk about a little bit today, though, that was I met this man about 2 months ago at an art market. His name is Rene Gonzalez, and he works in a program called Communities in Schools, which is trying to prevent dropout rates by focusing on mental illness. He started something called Wellness on Wheels, where he's getting the local middle schoolers and high schoolers and taking them on a bike ride through the city. And what he's doing is doing something active. So we're hitting that piece around exercise and routine, but creating a safe space to talk about mental health. So again, all of this becomes about how do we create a space for our children and for us to feel like we can talk about it. I want to make sure I leave some time for questions. And so we're coming to the end of my slides here, but this is the way I'm thinking about it. I want to emphasize one more time that this was a really broad overview when I'm thinking about all the different barriers that different communities of colors face. I think there's a lot of resources out there for each individual community that we have to kind of find to be able to help our children be able to utilize. So I appreciate everyone's time. I want to jump back over with Dr. Stevens. I'm going to stop sharing my screen now.
And thank you, because it's so timely. You speak about it, in a personal way. You have the experience, and there's some questions that I have in the audience. I'll start off with a few of the audience questions, and then maybe we can go from there. And again, this is all over the place. I was, talk about timely. I was just listening this morning to the radio. I think it was CNN on the way into work. And they're talking about, unfortunately, increased rates of COVID, especially in certain areas of the country, and how that relates to reluctance among some communities. There's a lot of, especially communities in the South, BIPOC communities that have had low rates. I mean, it sounds like whites and blacks have low rates, and there's just this, with the Delta variant, a big increase. You talked about a little bit with that, worries about, past medical abuse, I would call it, like Tuskegee and others. I mean, are you seeing that in your day-to-day practice in terms of psychiatric care? I just was wondering, or when you have to talk to people about masking and unmasking in an office, like I see you're in right now, does that still come up in everyday medical care from a mental health perspective for you?
It does. And I think my biggest response to it at the end of the day is time. So what I've learned in both my personal experiences as a patient and client, but also working with patient and clients, people in communities of color with that natural distrust want to know, are you going to listen to me? But also, can I trust you? The best way to build trust is time. And so some of this, when we talk about COVID-19, I've worked with a lot of our clients here around, why should I take this? I'm under 30. I'm not going to get that sick. And a lot of it for me is listening to that and sitting and addressing and not just telling them they have to do it or they don't have to do it or getting them out of my office, but sometimes having a 30 or 45-minute conversation with them around, okay, tell me about this. Or when they say, hey, I'm worried about Tuskegee. That wasn't that long ago. What if this is Bill Gates putting a microchip in, right? And so it's not laughing at that, it's not pushing that away, but it's sitting and saying like, okay, where are you getting this from? Here's what I understand. It's sometimes using self and saying, I've actually told one of my Black clients before, like, well, I got it in December, so if something's gonna happen, it's gonna happen to me first. So it's been a couple months. I feel good. I feel okay. So some of that is really just taking the time to build the relationship. But yes, it's still there. And I think a lot of that comes from, these are communities that often feel like they're neglected. And so they're not going to trust us unless we give them the time to show them we see you.
Switching gears a little bit, there's a question from the audience about biracial couples. And for biracial couples, what have been common issues you have seen in your work?
Ooh.
How does some of the themes you talked about today come out in the form of really a very intimate relationships? Are the same factors that you talked about, cultural misunderstandings, lack of awareness, do that come out in couples therapy routinely or no?
They do. What I was going to say is, in the infographic, there was actually a statistic after that I didn't include, but what we actually know is the rate for people identify as mixed. So if we're thinking about mixed children and they're coming from biracial couples, of mental illness is actually higher than any of those rates that we saw for the individual races. And a big part of it is they are carrying a lot of those divides. And so one example I know about recently is a couple had a child and they never had issues before, but now they're having a lot of issues with the in-laws. The children are young, but they have a lot of fear about what is this going to be like for the child, because one side is basically not seeing the other side of them. That becomes something that really, as parents, we have to sort out what are our boundaries, how do we want to present this to the children, which means how do we talk to each other about it first. If your mom is driving me nuts and being disrespectful, I need to know that you can be there for me and honor kind of this part of my identity. But yes, we do see that a lot. Again, I think the piece there is sometimes, one, if you're trying to do it on your own and it's not working, bringing in a third party, a consultant or a therapist that you trust can be really helpful, because a lot of times those are just hard conversations.
Going back about the diagnosis, and I think when you talked about some of the diagnosis that caught even my eye, I wasn't aware of some of that, the differential kind of diagnosis in the community. I think this audience member's question is about what you're saying. How can we make sure that our children are diagnosed correctly by professionals? Some symptoms are caused by many factors. You want to get to the point of diagnosis and making the correct diagnosis. You mentioned schizophrenia might be disproportionately diagnosed, not because of actual incidents, but I guess misinterpreting symptoms or how they're expressed as being symptoms of in that case, a very severe illness. So how do we make sure that especially children coming in are correctly, like you said, heard, but more importantly, understood in a diagnostic context?
Correct. And I want to emphasize what you were saying, Dr. Stevens, that a lot of times it is still that there's something significant happening there with the schizophrenia statistic. It is more about it's misappropriated. So what do we do? Well, the first thing as a parent is we have to do our research. And so this is where we really have to advocate for our children. Doctors will tell you and clinicians will tell you, at the end of the day, we're the expert in the illness and the treatment of it, but you're the expert in your family. So if something we're saying doesn't sound right, ask more questions. Sometimes it might be hard to hear what they're saying and they'll help you work through that. But sometimes it might be, hey, no, this just doesn't fit my child. So that's the first thing. I think the second thing is that's one of those where, depending on what is going on, you can talk to the clinician about, why do I need the diagnosis right now? For things like schizophrenia or bipolar disorder, yeah, those are things that have a strong biological aspect where we need medications, and diagnosis, having accurate diagnosis is helpful. For some things like depression, trauma, anxiety, you may not need the diagnosis as much as knowing what's the core problem that's bringing your child in, right? And so that's the piece of, especially with children, a lot of clinicians will be a little reticent actually to diagnose them too quickly for this reason. So if you're getting someone who's giving your child a diagnosis right off the bat, it's okay to question that and ask them what they're seeing, and to give you more resources to read about it. But we really have to be vigilant and advocates, because this is one of those things that it's not intentional on the part of the clinicians. It's going back to that the Western medical model thing.
Yeah.
We don't always neatly fit into how the diagnostic criteria come up.
Well, I'm going to push the audience members' question maybe one step farther, because I've heard this kind of question come at times from patients coming to the medical clinic and other places in my career. If there is a child, BIPOC background, coming into care for the first time, should that therapist be a person of color as well? Or is that something you should look for differentially? I mean, what would you say? Again, that was not the audience member. I'm kind of pushing the envelope a little bit, but what would you recommend?
That's a great question. And so first I'll say there is data that shows that the outcomes are slightly better when someone is working with someone who they match their identity. Now, that's typically when that is a core part of the problem set. So if I'm coming in for social anxiety and it has nothing to do with my identity, and I don't want to talk about my identity, I just want to work on the social anxiety, great, find an expert in social anxiety. But if my social anxiety is impacted by my race, having someone who looks like me or thinks like me or identifies similarly can be helpful. That said, what's more important is a culturally competent part. There are phenomenal clinicians who will be able to tell you, actually, this is what my training has been. These are the people I consult with who help me with this. And here's how we talk about it if I didn't understand something. And I think that's the last piece of it, is if you're working with someone and you're not sure, ask them how comfortable they are in asking you questions. You shouldn't have to teach them everything, but you're still the expert in you and your culture. So letting them know, like, I'd be happy to answer versus you just trying to figure it out. So in short, it can be beneficial, but it doesn't have to be the only barrier, because I'm also aware there are a disparity in the number of clinicians of color in the field, and we don't want that to become the reason someone doesn't seek help.
It's like the classic mental health answer. It depends.
No, very much so.
Some other question, I think this was good. You talked about news, and that, not to bury our heads in the sand, that kids are getting the same news we get. And I think this audience member's question has to do with that part that you raised. How quickly should we address something problematic that comes up in the news, recognizing our children are likely to have seen or heard this, and it can make them anxious? Should we wait or bring it up immediately? And if we bring it up, how to bring it up? How not to lead the witness, as we say.
Right. I think, this is another one of those where it's it depends answer. One, it depends on what's your family culture, right? So some families are very, very open. Other families, there's a hierarchy. And so I think some of that's talking with, if you have a co-parent, the co-parent, if not, thinking for yourself, am I fully prepared to talk to them about this? And I would make sure I've done my work before I go into it with them. That said, I'm a big fan of getting ahead of the game. So typically what I would do if I don't want to lead the witness and I'm not sure if they know about it, I might just ask them, hey, if they're sitting in the room when it's on the news, say, hey, have you seen any of this before? What are you thinking about it? Depending on their age, you want to be age appropriate. But the other side too is I think the thing I'll use as example again is George Floyd. That was just something we all knew was not going away. It was going to be there for a while. Yeah. So just kind of getting ahead of that and saying, hey, there's this thing that's happening that you're probably going to see. Let's start to talk about it. See what they already know. And then from there, you can start to build a plan of how do I want to introduce them to this?
Yeah, I think I also think sometimes following the child's lead. Having 3 children myself, I see this in daily practice. Not that we watch the news too much for the kids, because it's just I have an 8, 6, and a 3-year-old. The 6 and 3-year-old couldn't care. But I noticed that my 8-year-old will ignore a lot, but then see a story or two and start to ask questions. And then that was one. There was one about a story of a principal that spanked a kid who was about his age. I think it was in Florida. He was really interested in that. At first, he thought it was funny, but then we talked about how it felt to be the one who was being spanked. This was, I guess, a paddling, which is apparently legal in some areas of the country. I didn't know that. And it really led to a good discussion about how does it feel to be on both sides of that, you know, morals, ethics, and it was a really good discussion. Other times he just wants to see the score of the baseball game. So, and a lot of the other stuff doesn't care about. So
Right.
following the lead is what I did as a parent. I don't know if that's right or wrong.
No. That's kind of the piece where I was saying, like, starting to see what do they already know and kind of going with them. I used that in a much more succinct way, which is follow their lead, start from there. Because the other side is, especially with that age range from like 8, 9, 10, there is still age appropriate information, right? So you don't want to go into every single detail. That might just be too much.
Another question. This is a little provocative, but it does happen. As a parent, if I see my Caucasian child hating on, or I guess, you know, joking or saying, you know, having epithets on minority peers, what recommendations do you have for me to address that behavior? That's really close to home.
Yeah, and so this is a whole topic in and of itself. It's basically called allyship, and so it's what is my role when I see something that's not happening to me? And so the thing I will say is, without going too heady into too many words, one of the most difficult things for communities of color is both having to experience something and then having to explain to someone why it's wrong, especially when the person thinks it's innocuous, when they get defensive. As a parent, what we can do is start to help them understand why that's wrong. So one, I would say addressing it with them promptly and saying, hey, that's not okay. That's not how we do things in this household. But then also trying to understand, and where is it coming from? Where did you learn this? Why are you saying it? What's going on for you right now? I think you're in a unique spot as a parent to help your child understand, how can I be supportive and not discriminatory? Mm-hmm. So my answer is always confront things head on, because the more we avoid or try to address it passively, the less likely the child is to get the message. Now, honestly, they may get the message that it's okay or it's not a big deal. I don't know if that addresses the question.
I think so. I think that you know, to address that, but like you're saying, it's on our roles as parents to address that and to bring up our children, not carrying some of the things we grew up with, some of the prejudices. And I think that was a great question. Thank you for the audience. I had some things I jotted down. You know, I talked about COVID, and communities of color. What have you seen, or what are you hearing questions about? How has COVID-19 impact the mental health in communities of color, especially children? We didn't really talk about that, but that does not get on the news. We hear adults talking about losing a job, or especially older people losing maybe an elder member of the family to COVID, but we don't see the child aspect. What are you hearing about that, Michael? And what should we be aware of to be ahead of the curve on this?
Well, a big part of it is always, there's always a trickle down, right? So the first thing is, so again, using Black community, because I know the stats on it, about 40% of the workers in the healthcare field are actually Black or African American. So this is kind of your on-site workers, not necessarily your doctors or nurses, but your floor staff, things like that. So all of them had to stay and go into work at that time, right? Which means they're trying to split between going to work and teaching their children. So some of the impacts of that is they're falling behind in school. They may start to feel like they're not smart enough, they're not keeping up. Similarly, they see how stressed their parents are. And so that parentified child thing I was saying again, if I use the age range of your children, John, often What we see is that 8-year-old is going to start caring for the 4 and the 2-year-old. And the 8-year-old is going to see that mom and dad are stressed, mom and dad have worked, and then they come home and they're trying to teach the 4 and 2-year-old. So the 8-year-old is going to stop taking the space to talk to them about it. And they're slowly going to learn, I have to take care of myself, right? So those are some of the immediate things. The other things we see about, and I touched on a little bit in the presentation on the COVID-19 part, is children need connections. That's how they learn what's appropriate. That's how they learn what's not appropriate. That's how they learn that people care for them in the world, not being able to go to school has been really hard. And then on top of that, in a lot of communities of color, it, it, I grew up in Chicago, so what goes to my mind is the school was sometimes the safest place to be. Thankfully, I was moved out of that part of Chicago, but there was a good set of time where I remember my brothers walking home from school and being chased by some of the local gangs. So
Wow.
suddenly, some of the dangers that they are facing that they had protection there weren't there this last year. And so that's a lot more pressure and a lot more anxiety. That's a very specific example. But the point is, yes, it is having an impact. But I think because of the nature of the crisis, we just haven't talked about it as much.
Well, Michael, last question, I think, and this has been really, you've covered so much in such a short period of time, lived up to the billing that it got. I saw some of the advanced news in the Houstonian magazine about today's talk. I think it definitely lived up to that. Unless there's anything else, someone here apparently is interested in the 360 program, your new job. I know you're in the job only about a few days now, but tell us about the 360 program. And of course, does it take insurance?
So, John, I'm gonna have you help me with that last question because I believe I know the answer. But so the 360 program is a model called a Program for Assertive Community Treatment. It's a model that is actually a bit older than the one at Menninger, but it's this idea that we want to come to you. So what we know is when we take someone out of their home, every time they're hospitalized, that's a trauma in and of itself. And I can get into the whole history of how traumatic the psychiatric hospital system and the state hospital system was for communities of color, but that's another talk. But the idea with this model is saying, instead of having to do that when there's a crisis, we're going to come to you, right? So, the doctor will be in the community, the nurse can come and help you with your meds, the clinicians can come and see you where you are, they'll take you out in the community, they will, if you're working on social anxiety and you need to do an exposure, instead of seeing me in my office, and me saying, okay, go do these 3 exposures between now and the next time I see you, I say, great, let's go to the park and we're going to go talk to 3 people. And then we're going to bump that up to, we're going to go to the mall where it's more people. And we're going to keep working on this with you in person. So the idea is we're going to wrap around you. And what the data shows on that is in doing so, we actually see better outcomes over a longer term because we're not disrupting someone's life. We're not taking them out of their community. So going back to the end of the presentation, the holistic model, we keep you where you are and come to you so your life keeps going. As far as the insurance question goes, I don't think we are on any insurance panels, but we do provide super bills, is my best understanding. Is that correct, Dr. Stevens?
Yeah, I think unfortunately insurance is far behind the curve in many cases. I mean, a lot of insurance didn't reimburse virtual care until COVID. And I think the program like this is so far ahead that it's still going to take some time to catch up. But thank you for raising awareness. I want to thank Mr. Michael Riley, the new program director of the Menninger 360 program, a licensed clinical social worker. He's had 9 years of dedication to caring for people at the Menninger Clinic. I want to turn it over. I want to thank the Houston Health Science Museum for putting on this presentation, this really wonderful series. And I will turn it back over. I learned a lot. This is one of those that I'm going to have to get a refresher or watch the video. I'm glad it's recorded.
I'm glad it's recorded too. I learned so much today. Thank you so much, Mr. Riley and Dr. Stevens, for talking with us today about all of these hard-hitting community impact pieces in minority health. Thank you for those of you who joined us from your homes or wherever you are virtually. I think my daughter actually sat on this presentation. I think she learned a lot as well. Did you learn some stuff today?
Yeah, I did.
Very good. All right,
Fantastic.
everyone, please join us on Thursday, September 23rd for the 4th talk in the Parents Let's Talk About Mental Health series, where we will be discussing new solutions for overcoming substance use. So that is Thursday, September 23rd from noon to 1 p.m. Thank you so much, everyone. Have a great day.